Sneezing from sunlight. Some people sneeze when they step into bright sunlight, or when a light suddenly shines into their eyes. This is called a photic sneeze reflex, and it affects a large group of humans worldwide. The exact reason is not fully known, but experts think it has to do with how the nerves for vision and the nerves for the face and nose sit close together as they travel into the brain. When bright light strongly activates the vision pathway, the sneeze pathway may get triggered by accident. This reflex is usually harmless, but it can be surprising, especially when driving or doing a task where a sudden sneeze is not safe. Wearing sunglasses outdoors, giving the eyes time to adjust when going from indoors to bright areas, or shading the eyes with a hand can sometimes reduce these sneezes. The number of sneezes in a row and how often they happen can run in families, which suggests that genes play a role. It is a clear example of how the nervous system sometimes lets one strong signal spill into a neighboring circuit, creating a body glitch that looks silly but comes from real brain wiring. Sneezes usually come in bursts of 1 to 10 before a rest period that can last up to 24 hours. It happens more often after coming out of a dark room into bright sun because the sudden light change hits hardest. Women and people with a crooked wall inside the nose notice it more than others. Eye doctors sometimes see it during bright exam lights or when giving shots near the eye. Brain freeze. Brain freeze is that sudden, sharp forehead pain that comes when someone eats or drinks something very cold too quickly. The cold thing touches the roof of the mouth and the back part of the throat, cooling the blood vessels there. Those vessels respond by tightening and then quickly widening again, and nerves in that area send a strong pain signal. The brain sometimes reads that pain as coming from the forehead or temples instead of from the mouth, which is why it feels like the head itself is freezing. The best way to stop brain freeze is to slow down and let the mouth warm back up. Pressing the tongue against the roof of the mouth or sipping room temperature water can help warm the area and calm the nerves. People who often get headaches may notice brain freeze more, possibly because their head pain pathways are already more sensitive. Brain freeze is harmless and does not damage the brain, even though it feels very intense for a short time. It is basically a strong warning from the mouth and throat, telling you that the cold came in way too fast. Jaw popping. Jaw popping happens when you open your mouth wide to yawn, bite into something tough, or chew gum and hear a click or snap from one or both sides of your jaw. This sound comes from the temporomandibular joint, which is the hinge that connects your lower jaw to your skull right in front of each ear. Inside that joint sits a small, cushiony disc that helps the bones slide smoothly past each other. When that disc slips a little out of place, or the muscles around the jaw pull unevenly, the bones rub in a way that makes the pop. Things like grinding teeth at night, clenching from stress, or even an old bump to the face can wear on that disc over time and make popping more common. For many people, the pop comes without pain and does not stop them from eating or talking normally, so doctors call it harmless noise from the joint. Resting the jaw by eating soft foods, avoiding super chewy things, and trying not to clench can let the joint settle. A warm cloth on the jaw or gentle stretches where you open and close slowly may ease tight muscles too. If popping starts with pain that lasts, trouble opening wide, or headaches near the ears, then seeing a dentist or jaw specialist helps check for inflammation or misalignment. Eye twitching. Eye twitching happens when the tiny muscles in your eyelid start jumping on their own without you wanting them to move. This little flutter can go on for a few seconds or keep coming and going through the day, and it often shows up more when you are tired, stressed, or using screens for a long time. The nerves that control your eyelid muscles become extra excited and send fast repeat signals, kind of like a doorbell that keeps getting pressed again and again, even though no one is at the door. Caffeine from coffee, soda, or energy drinks can make this even worse because it makes nerves more active. Most of the time, eye twitching is harmless and goes away by itself after some rest or a good night's sleep. It does not mean you are going blind, and it usually does not mean there is a serious brain problem. Simple things often help, such as blinking slowly on purpose, putting a cool or warm clean cloth over your closed eye, drinking more water, and cutting back on caffeine for a while. If the twitching lasts many days in a row, spreads to other parts of the face, or makes it hard to keep the eye open, then it is smart to talk with a doctor. That kind of long-lasting twitch is rare in kids and teens, but checking in with a health professional can give peace of mind and make sure nothing else is going on. Hiccups. Hiccups are small jumps of the muscle under your lungs, called the diaphragm, followed by a quick closing of the space between your vocal cords and your throat. This is what makes the classic hic sound that can show up at the worst times, like during class or dinner. The reflex that controls breathing lives in the lower part of the brain, and sometimes this reflex misfires and sends fast, repeated signals to the diaphragm. Eating a big meal, swallowing air while talking and eating, drinking fizzy drinks, or sudden changes from hot to cold can trigger this reflex. Most hiccups last only a few minutes and go away on their own without treatment. People try many tricks, such as sipping water, holding their breath for a short time, or breathing slowly into cupped hands, and these may work by changing breathing patterns and calming the nerve that goes to the diaphragm. In very rare cases, hiccups that last longer than 2 days can be linked with irritation of the main nerve that controls the diaphragm, or with other health problems. And then a doctor needs to check. For a healthy kid or teen, short bursts of hiccups are simply a funny sign that the brain and breathing muscles had a brief miscommunication. Hiccups often strike several times per minute during a bout, before settling down. The left side of the diaphragm tends to twitch more than the right in many cases. Babies and infants can get hiccups too, since their breathing reflexes work the same way. Motion sickness. Motion sickness happens when the body gets mixed messages about movement from the inner ears, eyes, and body sensors. The inner ears contain tiny fluid-filled canals that sense spins and turns, while other parts sense up and down motion, like in a car or boat. When you are reading or looking at a phone in a moving vehicle, your inner ears feel the motion, but your eyes see a still page or screen and report no movement. The brain becomes confused by this conflict and reacts with nausea, dizziness, sweating, and sometimes vomiting. To reduce motion sickness, it helps to sit where the ride is smoothest, such as near the front of a bus or in the middle of a boat, and to look out at the horizon so the eyes and inner ears agree on the motion. Fresh air, small snacks instead of large heavy meals, and avoiding strong smells also help many people. Some families use special wristbands or medicines for long trips, but these should be used only with adult guidance or under advice from a doctor. Motion sickness does not mean something is wrong with the inner ear or brain. The system is working, just getting tricked by the way modern travel mixes fast movement with lots of screen time and close-up focus. Excessive yawning. Excessive yawning means opening your mouth super wide over and over to take deep gulps of air, even when you are not sleepy or bored. This reflex starts deep in the brain, where it links tiredness signals with cooling pathways for the head. When brain temperature climbs from focus or stuffy air, yawning pulls in fresh, cool oxygen and stretches jaw muscles to boost blood flow around the skull. The big inhale flushes out stale air too, waking up oxygen-hungry cells. Seeing someone else yawn often sets yours off because mirror brain cells copy the motion without thinking. Hot rooms, long talks, or holding your breath during focus can spark chains of yawns as a reset button. Yawns stay harmless and actually help by keeping the brain sharp through better air and stretch breaks. They pop up in planes or elevators to balance ear pressure from altitude shifts too. Chewing gum, sipping cold water, or stepping outside for fresh air cuts yawn attacks short. If yawns never stop with headaches or sleep trouble, a doctor checks for apnea, where breathing pauses at night. Babies yawn in the womb early, and kids yawn big during growth, proving it stays useful lifelong. Excessive yawning proves your brain knows when it needs a cool down and air boost, stretching wide to stay ready for whatever comes next. Skin crawling or formication. Skin crawling is the feeling that bugs are walking on or under your skin when nothing is actually there. It can feel like light tickling, tiny stings, or waves of movement. This sensation comes from nerves in the skin sending confusing or extra signals to the brain. Sometimes it is linked with anxiety, serious lack of sleep, or big changes in hormones, such as during menopause in adults. Certain medicines, withdrawal from some drugs, and some nerve illnesses can also cause this feeling. When the brain gets these odd signals, it tries to make sense of them and often labels them as crawling, which is a familiar idea from real insects. That is why people who feel this way often want to scratch or check their skin even though nothing is found. Gentle lotion, cool showers, and calming activities can help if stress is part of the cause. If this sensation happens a lot, keeps someone from sleeping, or comes with mood changes or other symptoms, then a doctor visit is important. The doctor may look at the skin, check for allergies, ask about medicines, and sometimes test blood or nerves. In many cases, treating the underlying issue or lowering stress also eases the crawling feeling. Teeth chattering. Teeth chattering is that shaky clack of your upper and lower teeth hitting together fast when you feel freezing cold or super nervous. It starts with quick, tight loosening cycles in the big muscles that lift and lower your jaw. Your brain's center for temperature sits deep inside and watches skin feelings plus inner body heat. When cold hits hard, that center flips a switch to make those jaw muscles twitch rapidly, burning energy to pump out warmth just like full body shivers do. The teeth smack because the jaw bounces between those squeezes. Stress or fear can spark the same chattering even in a warm room because your body's alarm system mistakes worry for danger and sends shaky signals everywhere, including the jaw. Some medicines for nerves or mood, plus low sugar in the blood from skipping meals, add to this, too. Breathing deep through the nose, sipping warm liquid, or wrapping up tight often quiets cold chatter quickly. For stress kinds, counting to 10 or squeezing a stress ball shifts focus from the jaw. If chattering sticks around daily, hurts teeth, or pairs with jaw pain or sleep issues, a dentist checks for grinding wear or loose fits in braces. Teeth chattering proves jaw muscles join the whole team effort to stay comfy inside, no matter what sparks it.